All right, so this is my project covering the Affordable Care Act. It was in course introduced in 2010 by President Obama, and in that it included expandage to Medicaid and Medicare programs for the low-income people. However, before the ACA was introduced, the uninsured and Americans could be broken down into three major categories. The first being low-income people. Those are just people that could not afford the premiums from private insurance companies. And the second one would be people with previous medical conditions. Of course, it's kind of like similar to car insurance. The more that you use the insurance from wrecks or speeding tickets or anything like that, the higher your premiums are going to be, similar to those. And those people would just essentially run out of money or ability to pay those premiums anymore. And then the third would be people like myself, young, healthy Americans that just feel like it's not worth the money. And, um, we just don't really need it. It's useless to us. The ACA gave many opportunities. It paved the new path for health coverage for uninsured people. Within the ACA, they, like I said, reformed Medicaid and Medicare programs to help the elderly and the low income families. It also required health companies to spend a portion of their revenues from premiums on covering medical costs rather than, um, their related bills on billing and insurance related costs. This meant that the insurance companies actually had to focus on the customers more than the company itself. Of course, with Joe Biden coming into the office, he set out to revamp the ACA, and he wanted to create a government-run uh, health insurance agency that would compete against the private health insurance companies. The program aimed to help those who could not afford the high premiums or was denied health care based on that medical condition. So the ACA had improved the numbers of uninsured Americans from 2010 to 2014 by over 22%, which created a record low. So it was doing a really great job in the beginning. However, still nearly 30 million Americans were still uninsured. Those people stated that the insurance was just still too expensive for them and it was just not justified by the cost. Um, However, there were people that still fell through the cracks of this process, and those were the people that made too much money to qualify for Medicaid or Medicare assistance, but didn't make enough that they could pay for those private insurance premiums. So I believe the threshold was 17,000 and some change, and so they made just too much above that to qualify for any assistance, but of course they didn't make enough to pay for their own premiums for private insurance. Um, to prevent that or to counter that, the ACA introduced the following policies: the Title One, Two, and Three, and then Title Nine. These policies were supposed to solve the problems, but failed to do so as the number of uninsured Americans continued to grow. And within that, by 2017, I believe it was at an all-time high. And so obviously it was not doing very good, and it was called into question on how good or how effective and whether it was worth it to even have it anymore. Biden's new plan, he wanted to challenge the private insurance sector, allowing individuals to opt in for the public option over a private coverage. So the ACA also required individuals to sign up for coverage or pay a penalty. That penalty could be up to 1% of your taxable income. So what that meant was it was an individual mandate so that you had to have insurance coverage. And what that would do is that would reduce the premiums for the people that actually needed it. So essentially, the more people that are in a pool, the less that it costs everybody to pull out of. And that was the goal of it. However, Texas and I think 19 other states, following President Trump, challenged this. And when Trump came into office in 2017, he actually signed in the TCJA Act, and that within it took away the 1% penalty, but it still left the mandate. And so the 20 states, including Texas, all still challenged the lawsuit and sent it all the way up to the Supreme Court. And as of right now, I could not find anything on the verdict. So I'm assuming we're still waiting for that. And then, of course, with COVID in the past 2 years, it came a ton of implications for Americans. So millions of Americans obviously lost their jobs, and those were the lucky ones. Of course, we lost a bunch of Americans this year and last year due to this virus, but a lot of them were on ESIs or employee sponsored insurance programs. And so when they lost their jobs, they lost their health coverage. And then, of course, if they contracted the virus, they had to pay everything medical wise out of their pockets. And that could go from 40,000 to 80,000, just depending on what type of conditions. But the average was within that range. And of course, that had to come out of their pockets. And so it showed Americans that there was a flaw in our healthcare system. And those Americans, there was always still be Americans that refuse to adopt the ACA. They fear that it will create a government intrusion into the private healthcare system, and that it's not needed, and that they fear that we would eventually morph into a nationalized healthcare system, and they feel that's unconstitutional. Um, and I mean, I personally believe the ACA did a fantastic job of getting us closer to universal healthcare. I believe it's a very hard subject and a very touchy subject, similar to like world hunger. I don't think there will ever be a point where we will be um, at that universal healthcare, but I do believe it did do a great job at bringing us closer to it. There are still millions of Americans who feel like it's unconstitutional for a universal healthcare system, but I know for a fact, those 3 million Americans that lost their employee-sponsored insurance, that they should be relieved and thankful that the ACA exists because I know it saved them, and it's provided insurance to them when all hope was lost. And so overall, I think the ACA, it brought us closer to universal healthcare, but I still feel like we as a country are far from having universal healthcare. Um, and that's it. Hopefully, the ACA and President Biden's plan will, you know, continue to build to it and make it better, and not ruin what we've already progressed to. So, thanks.